Hi, my name is Dr. Chantal Thomas, and I'm coming to you from Access Community Healthcare Center. I'm here to talk to you a little bit more about some of the specific strategies that the behavioral health team can use with your patients when we're talking about managing pain. Um, during one of the previous educational videos, I talked about the importance of coming together with your patients in terms of a strategy around narcotic management, whether that be titrating off narcotics or limiting the number of narcotics that you're prescribing, or just checking in more frequently with your patients about other strategies that you want them to use in conjunction with their opiate medication regimen. So, before behavioral health would be involved at this next phase, you would already have clarified what that agreement is with the patient that you're working with, and I think we've talked a lot about the idea of behavioral health being involved in terms of helping with coping with pain, and these are some specific therapeutic approaches that can be used in terms of helping patients cope with their pain problem to improve their quality of life and also their emotional, psychological functioning. So, some of the strategies that our team members are trained in include cognitive behavioral pain management strategies. Another one is acceptance commitment therapies. Another therapeutic approach that can be very helpful when talking about managing chronic pain is also mindfulness based meditation. For a lot of individuals that we work with who have difficulties managing their pain condition, just as with the general population or the folks that we work with here in terms of our patient population, being assertive and setting limits with other people in your life, or being able to say no, or being able to advocate for yourself can be a real challenge, particularly within the context of a chronic pain condition. So, part of the work that we might do with someone is helping them to set limits and be assertive with the people in their life in order to make sure that they are engaging in the appropriate amount of self care. And the other piece of this is just increasing emotional awareness in general. I think that unfortunately, we don't do a great job with teaching people in our culture how to recognize what they're feeling, giving them language to talk about different types of feelings and how that might impact their day to day functioning. Particularly with certain patient populations, we really have to get very basic about the range of affect that one can experience, the range of emotional experiences that one can have, and how to talk about that, and how to recognize how those emotional experiences might impact your quality of life, and also how you manage your pain. So, the first thing that I'm going to talk with you about is cognitive behavioral therapy techniques as they are applied to the realm of chronic pain management. So, one of the things that I've been struck by when I'm working with patients here and in the past, when it comes to managing a pain condition or a chronic pain condition, is how dramatically these conditions have defined their concept of themselves, their identity, their relationships with other people, their relationships within their family, their children. So that's a very important thing for us to understand, to explore, is how pain has impacted your life on multiple levels. Your roles within the family. A lot of people who end up with chronic pain conditions have been doers and used to taking care of other people, being providers for other people. And so a chronic pain condition can really dramatically impact your sense of your self concept, your sense of value, your worth, and your role in life. And that is an important thing to understand, to process. And it's often a thing that gets missed for a lot of people. It's very hard to talk about that. It's not the most natural thing to move into that type of a discussion with the people around you. I think it can be quite painful. It can bring up feelings of vulnerability. And I think for those reasons, people may not be inclined to volunteer that information to people around them, especially when they're already feeling like a burden or when they feel like they're not as effective as they'd like to be. So that is definitely a conversation that we can have with folks here in terms of understanding how pain has impacted things. Will that change their pain levels per se? Not necessarily. But will it help them understand a little bit more about how relationships in their life may have changed and what might be an answer or a direction that they can move in as a result of having that awareness? And recognizing that there is the possibility for evolution, there is the possibility for changing your self concept or deepening your understanding of what it means for you to be in relationships, not just relying on your ability to always physically provide for other people. Another part of how cognitive behavioral therapies can help inform our understanding of how pain has impacted someone's life is also looking very specifically at the cycle of pain that someone experiences. When are times that you typically get exacerbations in your pain? And how does that impact things? What are your activity levels like? What are the toughest times of day or the toughest times of year? Or the toughest times of the week or month for you? It's important to get a very good sense of those things that can be very helpful in terms of helping people better anticipate problem areas, problem spots, and how to compensate for that. Another thing that we can do is set activity goals that are in line with what an individual might want in terms of their physical functioning and their emotional functioning. So, sitting down together and setting realistic activity goals for a patient can be incredibly important in terms of them feeling like at least they're moving towards something that's realistic and attainable, as opposed to setting goals that are not realistic based on their level of debility or their level of pain. Another aspect of cognitive behavioral therapy incorporates the idea of learning strategies for relaxation. So understanding that when you have a pain condition that can cause a constant sense of stress on the body, and that can be affiliated or associated with autonomic arousals. So one of the strategies that we want to make sure that we are teaching people is how to decompress, how to reduce stress and tension and autonomic arousal in their nervous system. And this can be through various types of techniques. It can be through progressive muscle relaxation. It can be through guided imagery. We can do those techniques with folks. And that definitely can have an impact on their experience of pain and the pain intensity. As we all know, anxiety and stress and your thoughts and your beliefs about your ability to tolerate the pain that you're experiencing can certainly enhance, activate, exacerbate a pain signal. So we also want to understand those connections. We want to understand how your beliefs and the stories that you tell yourself about your pain and your pain condition and your experience with stress and with anger and irritability, how does that connect or impact your pain levels? It's always quite surprising to me when you're speaking with a patient and you ask them, do you notice that your stress levels or your emotions day to day can impact or affect your pain? And a lot of patients will say, no, I see no connection, which is usually a good indicator that they basically could use some development in terms of understanding those relationships. And that may quite honestly be for a lot of people when they say there's no connection there, that may be because they have a lack of awareness or understanding about their own emotional experience and how that might impact things. Another common difficulty for folks who struggle with a chronic pain condition is that they don't know how to pace the level of activities they do on a daily basis. So they are trying to function as though they did before they had a pain problem. That's very common. And particularly on days that are considered good days, they try and do all the activities that they haven't been able to do previously, or on a day when maybe perhaps they take more medication so they are feeling less pain, they overdo it and they save up all their house chores for a good day, such that their bodies go from complete immobility for days to even 2 hours of continuous work would be a tremendous toll on a body that's used to being sedentary in the days preceding. And then what we see following that is that pain gets worse the following day, and then it gets even worse 2 days later. And then we have a cycle where more pain meds are needed to be, more pain meds are taken, and patients feel like if they do any sort of activity, then they're disabled by pain. What we're teaching people to do is take more frequent rests or more frequent breaks, which may be something that they're very uncomfortable with, that feels counterintuitive and is not what they used to have to do. So that is something that takes a lot of diligence. It takes a lot of monitoring and reminding. It's a skill that someone learns. So we can work with folks who are motivated around that area as well. And I think the other big area for development in terms of the CBT world, when it comes to managing pain, is really spending a lot of time on sleep cycles. It is incredibly common for people who struggle with chronic pain conditions to have very dysregulated sleep cycles. And that, I believe, that's partially to do with the way they are handling activity versus inactivity. A lot of patients may spend a great amount of time in bed when they are having increased pain days and not even getting out of their bedroom, as what we know about sleep, how negatively that can impact someone's ability to sleep appropriately in their bed at the right time of day. There's so much room for us to further develop strategies to help them create some routine in their sleep cycle, even if there's some limited routine during their daily cycle. And that's also something that we can enhance and create more structure around, because generally speaking, we know that folks who have a routine, who have a cycle that they work on, generally have a little bit more enjoyment because they're able to structure in activities that give them a sense of pleasure, and structure in activities that actually add some value to their life. The other major therapeutic approach that we can apply very easily to chronic pain management is the acceptance commitment therapy for pain. You will also hear this referred to as ACT. And this takes a little bit of a different approach, and it's definitely a skill that you teach a patient. This is not necessarily intuitive. In fact, many of the concepts are counterintuitive. So one of the core concepts behind ACT, particularly when we're applying it to chronic pain management, is they're conceptualizing the patient's desire to avoid all pain as the core of the problem. So, and that just by itself can sound very confusing to a patient. But what you're doing with ACT is you're helping patients identify their resistance of their pain problem is part of what causes most of the suffering. So there's a lot of thinking and ruminating about wishing that they weren't dealing with pain, and every time they have a pain signal or experience pain in their body, there's just a tremendous amount of struggle against that. And that struggle against the fact that pain is present is part of what causes a great deal of suffering. We use this therapeutic approach as well when it comes to dealing with negative emotions or negative affects such as depression or anxiety. It's the same exact module, but it's just applied in a different way, more along the lines of emotional pain that's endured when it comes to depression and anxiety. But once again, the concept is the same, that we have limited control over the presence of physical pain, but we do have control over our beliefs about it, our attachment to that pain, and our emotional reaction when we notice the pain. So part of the theory behind this approach is the idea of really coming to a place of peace around the idea that you actually have pain and that it's going to be present, and it's likely going to be present for the duration of your life. That can be challenging. It does not mean the same thing as you are giving up on trying to manage your pain, but you are absolutely accepting that it is going to be present. And this therapeutic approach really encourages patients to make conscious and intentional choices around the activities that they have throughout their day, and then to take action on what those things are. And part of how we identify those things is by exploring the patient's various values in their life. So that might mean shifting focus away from physical pain signals and talking about their desire to be a better husband, or a better wife, a better father, or a better mother, and identifying activities or behaviors that are associated with those areas in their life that they value. And in particular, it helps people look at their mental scripts. So that's the stories that they tell themselves about their condition, um, and how those stories lead to avoidance behaviors. So because you're so resistant about the idea of having pain, then you avoid anything that makes you aware that you have pain. And as a result of that, you avoid pretty much everything else in your life. So your quality of life is significantly compromised. So again, ACT emphasizes the idea of shifting your focus and shifting your energy to the things that are actually within your control, and eliminating the pain altogether is outside of your control, and that's a futile endeavor. It's like patients who say, I never want to feel sad or I never want to feel anxious again. That's just not putting your energy in the right direction, and instead focuses on teaching patients that they can tolerate those pain signals, the pain experience, without panicking, without catastrophizing, and instead structure their life in a way that emphasizes things that are within their control, such as their value and the things that they value in their life. And it also teaches them, through various strategies, how to create a little bit of distance from some of those thoughts that are catastrophic or cause people to feel very anxious or depressed or hopeless about their condition. So that's a brief summary and overview of some of the strategies that we can use if we get to the phase where a patient feels like they have some diagnostic clarity, that they have clarity with you in terms of what the plan is for their medication regimen, and now they're interested in exploring other strategies or other approaches that might better help them understand how to cope and improve their quality of life in general.